Welcome back to SG Dr. Wellness. My name is Dr. Chen Yiming, and in this weekly medical educational video channel, I will be talking about blood in your stool. So what are some of the causes of blood in stool? Is it a common condition? And when should you be worried about a serious medical issue? Let me share with you some of the red flags you should be looking out for in this video. Watch till the end. If you're new to our channel, click on the subscribe button now. There are many causes of blood in stool. Some of the benign causes include passing of hard stools resulting in anal fissure, hemorrhoids or piles. Other slightly more serious conditions include infection of the intestines by viruses or bacteria, inflammation of the colon due to inflammatory bowel disease like Crohn's disease or ulcerative colitis, abnormalities of the blood vessels in the rectum and intestines resulting in them bleeding, diverticulosis or diverticulitis, which are structural outpouching of the intestines with infection. And of course, the most feared causes of bleeding in stool would be cancer of the rectum or colon. There are some not so common causes that I did not mention here, so the list above is non-exhaustive. Naturally, as a layperson, you'll be going, wow, that's a lot of causes for blood in my stool. I hear you. So now I will highlight to you some of the accompanying signs and symptoms that will point towards a serious issue that requires urgent or immediate medical attention. Firstly, severe bleeding. If the bleeding is continuous and massive with large amounts of blood filling the toilet bowl, it is definitely an emergency. Or if you are exhibiting signs of low blood pressure due to severe blood loss like giddiness or almost blacking out episodes, if your fingers and toes are pale and cold, or if you are breathless or having a very fast heart rate. Secondly, fever. When you have blood in your stool associated with a fever, then the causes may likely be infective or inflammatory, such as viral or bacterial gastroenteritis, which means infection of the intestines, inflammatory bowel disease like Crohn's and ulcerative colitis, which are autoimmune in origin. Thirdly, when you have blood in stool with severe pain of the abdomen or the rectum, severe pain usually indicates a serious condition such as infection, inflammation, or even rupture of the intestines. Fourthly, if you have been having small amounts of blood in the stool for a long time associated with weight loss or loss of appetite or even change in size of your stool, I would be very concerned about cancer in the colon or rectum. Thankfully, the vast majority of patients presenting with blood in stool is usually due to piles. Bleeding due to piles are usually small in amount. The blood is usually seen only on the toilet paper when you clean your rear. The blood is almost always fresh and almost always occurs only on defecation. There should be no fever and there should be no abdominal pain. Having said that, please do not self-diagnose piles and ignore your symptoms and signs. Do visit your family physician or colorectal surgeon for a confirmatory diagnosis. To avoid developing piles, please adopt these few lifestyle changes. Avoid straining during toileting. Avoid prolonged sitting on the toilet bowl. Ensure adequate fruits and vegetables and whole grain in your diet. Drink plenty of water, up to 6 to 8 glasses a day. Exercise. Don't hold your bowel as it may make the stool harder and more difficult to pass subsequently. Treatment of piles is rather straightforward. There are conservative methods such as stool softening medication if your motion is very hard, Teflon to reduce venous congestion of the piles, minimally invasive methods like rubber band ligation of piles or injection of chemicals to shrink the piles, and in severe cases, piles removal surgery. So there you have it. Bleeding in your stool is a very common problem. Recognize the signs and symptoms which requires you to seek immediate medical attention. Thankfully, most of it is caused by piles, so again, whenever in doubt, please get a consultation with your family, physician or colorectal surgeon. Subscribe, like and share this video if you feel that it's helpful. Till the next time, stay safe and stay healthy.